Welcome, Peter, to the Cuban Coffee Effect, our new podcast, which, as you know, has a little bit to do with our Cuban background. And the Cuban heritage has a lot. Our background has a lot to do with Cuban coffee and how we use Cuban coffee to welcome people, to open up conversations, as kind of like our breaking of bread. We go see our doctor, we go see our mechanic, we go see our neighbors, and we always bring a nice colada with Cuban coffee, and we share it with everybody, and that kind of welcomes everybody in. So our podcast is called The Cuban Coffee Effect because we welcome our guests here to come in and talk a little bit about and open up about what they're doing and this and that. So again, it's good to have you here.
Cool. Thank you, Mike. Thank you for having me. It's a pleasure, and it's definitely an effect. The Cuban coffee has an effect.
Yeah, the secondary effect is a little bit more uplifting, but the first effect is kind of opening up the thing. But anyways, you've started a company recently. It's been up for open for how long?
2 years, but it's the latest and greatest out of probably another 5 or 6 different platforms it took to get here.
StressFreeHealthOptions.com. As we know, we have a serious problem in this country with healthcare and health insurance, and it's you can't turn whatever channel you turn on, and there's news going on. You're finding out that everybody's trying to figure out how to get the best of it. In the meantime, we're all trying to work out what we do. And you guys have come up with a pretty interesting solution that's helping hundreds of people, thousands of people maybe by now, find the right healthcare. Because the problem in the old days was you had to kind of go and your local guy and knock on the door and find out what health insurance you can get, or whoever came and sold it to you at whatever time. But now with the internet and with digital marketing and all this, you can really find out anywhere in the country, in the world, what is the best and the latest, and it kind of matches you up with the right thing. So you're kind of like an advocacy group, right?
That's right. And it's
a little bit.
That's right. And it is an advocacy group, and the name Stress Free because it is stressful. Healthcare has been very stressful. Yeah. It's been very strained. It's a mess. It's been a mess. And since the 90s, Clinton administration started to see the numbers and how we became, the population started to get more unhealthy. We started to live longer. Our healthcare expenses went through the roof. Inflation went through the roof. And so what you talked about earlier, that old agent kind of coming in and not and helping you and figure out what options were best available for your family.
And it was limited. You had what was ever available right there locally in your market. And there's a lot of areas that don't have anybody.
That's right.
We think about the big
metropolitan
metropolitan.
That's right.
You got the rural areas that they don't get this kind of help but the internet has kind of changed that.
Well, that's correct. And even so, now there's so many reforms and programs that came about since 2010, since the Patient Protection Affordable Care Act, which is also known as Obamacare, right? Mm-hmm. That really law is a 2,000-page law that changed forever healthcare in our economy, in our country. It's actually the biggest law passed since like 1935, the Social Security Administration Act,
really?
The FDR. That's how big that. So healthcare has been a huge overhaul. It's a $1 trillion industry, and changing how our healthcare delivery system. Insurance is a part of that. And so it's been a mess since 2010. And the reason it's been a mess, it's because there's been a lot of overhauls in order to try to make it work. At the end of the day, we have a very unhealthy population, a dying population, a sick population, and just the insurance premiums and just the way that our healthcare delivery system, our economic healthcare delivery system was broken. It's still, now it's 2019, so 9 years after Obamacare passed, so they're starting to stabilize on what's working and what's not working. But we still got a long ways to go. But stress-free health options really just sits at the core. It just sits at the center place of that mess. It's kind of really we solve a lot of issues in the healthcare, and so again, it's an advocacy. What does it advocate for? It advocates for a lot of the essential, and there's 10 main essential health benefits under the Obamacare law, which is the name of the law is the Patient Protection Affordable Care Act, right? So it's an act of 2010.
But is this an Obamacare insurance?
No.
Insurance? Does this have anything other than what the law changed? Does this have anything to do with Obamacare? I know a lot of people, some people like it, some people stray away from it.
Yeah.
Does this have anything to do with what? Okay.
It does, because and that's the thing. People think Obamacare is an actual, like a plan. Remember, Obamacare is a jargon. It's a coin. It's a term that's used for this law, this 2,000-page law, right? Which encompasses from billing practices, Medicare, fraud, waste practices. I'm sure you remember the big, all the doctors complaining for years about how their medical practices had to change. So electronic medicals having to go digital, that was part of the law. There's so many facets of the law. Prescription. Listen, the substance abuse crisis, epidemic. It's an epidemic. When you reach the numbers that our country is seeing, and people dying due to opioid use, it's an epidemic. So those are the things that the law went to go and solve, right? And more importantly, which is where Stress Free has really put a lot of its focus advocating for, is the elderly population. What we call it's a very vulnerable population. Majority of seniors are broke, they're unhealthy, and they have limited resources. So there's so many options that are now available to them. This law has helped, obviously throughout the process. And that's what Stress Free advocates for, is helping consumers, whether you're Medicare, age 64 over, or 64 and under, which is basically, the rest of the population, finding those health solutions and the health options that fit where they are, right? If it happens to be a social program with Medicaid state help in that region, that's what it is. If the shoe it fits and the person is coming in and they need a private plan and they have the funds to pay for it, which, by the way, that's a very small percentage of the population. But if they are in a metropolitan, and they have the financial resources, then Stress Free helps them with the best plan according to their situation, right? So that's really, it's a healthcare destination. Yeah. Stress Free Health Options is a healthcare destination for consumers, and it's digital, like you said. Yeah. So it's a digital platform.
And what do people do? They can go on to this website, stressfreehealthoptions.com, and I think from what I saw, they got two options. They can either make a phone call and get right on the phone with somebody, licensed insurance agent, telling them what they need to know, answering all their questions, or they can fill out a little form that takes a couple of minutes from what I saw, a little bit of background, send it off, and then they get the information back to them, or they get a phone call back to them, or a text, however they prefer. Some people prefer text, some people prefer voicemails, some people or regular phone calls, some people prefer emails, and at the time that they like. That's the other thing. You can go on there and say, don't call me between 9 and 5, I'm working. Call me at 6:30 at night before dinner, but once I get home, that's a good time for me. And you can call them back at that time, and that's the time that they can sit down and talk to you a little bit about. And then a licensed insurance agent gets that information from them and gives them the best options, right? And according to where they live, according to their state, their city, their financial situation, and finds them health insurance, which
That's
helps.
it.
That's a great thing.
And that's one of the things that the internet has provided in this digital era, this digital new era really has flattened kind of the world, right? Where we can have that free flow of access of information. And we have it at our fingertips, and again, that's something that we facilitate, right? The old-fashioned way was you had to kind of book an appointment or have an agent come out to the house, or take the agent's word for it too.
And this could be Medicare, Medicaid, you're over 60. Because I know, for example, like my mom, I'm always on top of what's going on with her. She's 86, so I'm on top of what's happening. But I don't know anything about Medicare, and it's confusing as hell to
Very
find out,
confusing.
Part A, Part B, Part C, Part D. I don't know what all that means. So I got to know what she's able to what's covered,
That's right.
what's not covered, what's in her plan that's being paid for,
That's right.
that she has the right to, but she's not using. Does she get to go here for therapy? Does she get to go there for this? Does she, you know what I mean?
That's right.
So there's a lot of things that I don't know. And who's going to sit there and read a freaking policy, and much less a Medicare policy
That's right.
from the government? And now, speaking of that, your company is, or you yourself, been certified, like, there's only like 30-something, that's what I was reading. There's only 30-something companies that are certified by the government to sell or to do this type of thing
Yes.
that you're doing. How does that work?
Yeah. So, and that's, yes. And it's, so there's a, you got to understand, this is a process that, that law was signed in 2010. It encompassed a lot of technology, right? And so, to be able to provide a kind of a flatline electronic application solution for people, right? Especially people that are going to be receiving government help, government benefits, especially in the Medicare population. Medicare, 95% of Medicare recipients, and there's 64 million Medicare recipients today. By 2030, which is only 11 years from now, it'll rise to 92, 93 million. So that tells you that there's, the Medicare population is only growing. It's not even saturated yet.
Wow.
And so there's so many benefits available to them, right? And so but to be able to deliver these healthcare services, a lot of technology needs to be applied, a lot of protection, right? So you got a lot of health insurance portability, accountability laws that protect the consumer's information. So to be able to do this online, the federal government in 2014 rolled out their web platform for private entities to enlist and to say, okay, plug into our healthcare.gov backend, because obviously with the failure of the website when Obamacare launched in 2014, they realized, okay, we need to enlist the help of private sector. And so they took the brokers that were in the community, took the healthcare companies that were in the community, and said, "Hey, listen, help us roll this website out." And we did. So there's only 36 of us in the country, and so we have the ability to connect directly with healthcare.gov and their hub, their data services hub, and be able to kind of provide information back and forth to figure out what this person actually qualifies for. And so when you look at that technology integration, that's another thing that makes stress-free health options stress-free and so unique. We've built a lot of technology, a lot of algorithms throughout the years, working with the federal government in all these cross technology platforms to deliver a better healthcare solution, healthcare delivery system. We know, for example, in your case, Medicare is extremely confusing. And although an agent can sit there for like 2 hours and give an educational speech to somebody about how Medicare works, what we do is we kind of take a different approach, and we say, okay, we know that, for example, people in your mother's area have a propensity to be this age group and need these services. So the way in which we reach that audience is very, 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 very unique, very tailored. And so when you call in, or you or she calls in, right, or goes on the website's already kind of profiled and said, hey, there's a 90% propensity that these are the programs, or these are her challenges in that area. These are the problems associated, and these are probably the challenge. So then the next thing for us is to quickly set that off, right, and connect you with a licensed, insurance verified Medicare agent in your region that has all the credentials necessary to be able to advise you, and do that in about 5 minutes or less.
Wow.
So
that's pretty cool, and they can do it that fast, because this is all they do.
Fast.
This is
It's
all they
fast.
do.
It's fast.
And it doesn't matter the state.
That's right.
And they even include vision, and even if it's not Medicare or Medicaid, they can there's also plans that include vision and dental.
That's
I
correct.
saw as well.
That's
That was
right.
pretty interesting.
That's right. That's right.
And you know what? Let's have you want a coffee?
Let's do it, man.
Yeah, I'm ready for a coffee here because I'm a little bit. Grab me that
Yeah.
Llave. By the way, this is one of our best friends, the Gavinia family from California. 150 years in the coffee business. And they make Don Francisco. They make the coffee for all of McDonald's. These people are huge.
That's
Cuban
right.
family, very successful, very beautiful people. Lisette Gavinia is
Yeah.
a friend of mine. She's been here before. I've interviewed her. And she sends me these coffee from La Llave. This is the best coffee.
Yeah.
To me, when it comes to Cuban coffee, Café La Llave is number one.
I agree with you.
And they
agree.
don't pay for any sponsorship or anything.
No.
It's just my personal opinion. By the way, my father, rest in peace, passed away about 10 years ago. Typical Cuban cigar smoker. This was his coffee, man. He made me always go and buy him La Llave. He didn't want anything else because this was the best stuff, man. So we'll make some of this here.
That's it. Nice.
Yeah, give me a cup there.
It is good
It
coffee.
keeps us going,
That's
It
great.
keeps us
That's
going
great
in these podcasts because sometimes after lunch, things get a little, a little tiring. So, and being as that we're the Cuban coffee effect,
That's pretty cool, Mike.
we got to keep this thing going,
I like this
would
whole
make it
concept.
strong.
This is a really interesting. I know you've been working on this for a while, and
It's
man,
gonna be cool.
It's exciting. It's very exciting.
You know what? It's good that we're gonna talk about everything. Tomorrow I got Danny Jimenez coming in, and
Sure.
we're talking about Macallan Scotch and how Scotch is made around the world, and how to drink it, and how to choose the right Scotch
Sure.
for you, and stuff like that. So we talk about situations with that are happening in the world, like insurance, and
Sure.
how we can help, because people are going to like it and find out what they can do. So we inform, and then there's things like tomorrow that we entertain at the same time. We show people what it's all about. Things like that. We got him, Beto from
Of
Fratelinos.
course, yeah.
He's
yeah.
coming in
Oh,
on
great guy.
Wednesday. He starts show on
Interesting,
Wednesday.
yeah.
What a guy! What a
Oh
character!
man,
Huh?
that
What a
guy's-
character!
there's never a time that a conversation that you don't leave laughing and having a great time and learning something too.
The restaurant's phenomenal.
Yeah.
It's had all the success in the world.
Yeah.
But to get there and to have Beto come and hang out and give you stories and talk, it's entertainment at the end of the night.
entertainment.
So I figured
It's educational and entertainment.
Yeah. He's a wonderful guy,
It
wonderful
is.
person, the whole family, and very interesting. So this is really cool. How does the digital, because everything now is digital, how does digital advertising, digital marketing come into play? In other words, how do people find out about stressfreehealthoptions.com? How do they get there? How do they dial? How do they, obviously through ads that you run in magazines or newspapers and these shows and televisions and videos that you have on YouTube about stress-free health options. People dial in and people do all that kind of stuff. But and that's a way that they can find out, more information. But you do a lot of your majority of everything you do. Your push is all in the
100%.
digital market.
100% is digital.
Yeah.
100% is digital.
Yeah, whether it's video or anything, it's all digital, right?
Hey,
You want a coffee, man? I don't want my producer back there to fall asleep. You sure? Yeah, I get your coffee. Make your coffee, man. No?
I'm good for right now.
You're good for
that's
right now?
good. He's
All
good.
right, man.
Bueno, salud, Mike.
Hey, here we go. Okay.
Good stuff, man. Good.
people are the
Really
best.
good. Excellent. So yeah, I'm 100% in the digital marketing. 100%. Again,
You've been in business, in the
been in-
insurance business for how many
yeah,
years?
since 2005. So
2005.
2003, I started in the brokerage firm and financial services and stocks and bonds and all that. 2005, I got my insurance licenses, and that's really when I've been in the business deep into that since then. In 2008, I started to see, the pattern. So I was 100% already in a call center environment. All my sales were telesales. And at the time, insurance was being sold and purchased over the phone. Okay,
Right,
it was
right.
being searched
Typical
online.
traditional way.
And health insurance was the very first to come online.
Hmm.
It was the very first insurance to come online, and I was at the forefront of that in the early 2000s. So I was at the right place at the right time, I guess, and putting my best foot forward. I knew that I had to be in digital marketing because for my business at the time, that was the glass ceiling, right? So there was a glass ceiling to grow your company, and that glass ceiling was your ability to generate your own leads. And yes, you could generate them through TV ads, and you can. But at the time, again, the market was already 100% online. So it was like still maybe 10% of the market was not searching for online. So I had no choice. If I wanted to create my own future, I had to be digital. So since 2008, I've started reinvesting, my firm's money back into that to generate clients, and I did that. And in 2010. When the passing of the law, then it was definitely evident and clear that if you weren't deep in with digital marketing and you didn't have a large scaling business, you were out. And so thousands of brokers closed, and I flourished. I flourished because I was already digital.
Early on, nobody was doing that.
Nobody. Well, there was some
very few.
Some, yeah.
But even nowadays, I notice in a lot of businesses that I go to, successful businesses here in Miami, that you go and you see a lot of successful businesses, and everybody's doing the digital stuff, and they're doing a little bit of the social media, and they're doing their website, of course. Nobody really knows what they're doing. Nobody really knows what to do. Everybody kind of knows, I need to get more likes, I need to do some posts, I need to do something. There are very few people are really taking advantage of the digital the way that they should. More and more every day, but it's such a new business.
Because it's like a trend in anything, right? When something is new, right? So when a new technology arises, it's always the people that go deep in their what we call technology accelerators. I know you've been reading the Good to Great book, right?
Yeah, God.
And so there's the technology.
When was that book? How old is that book?
It was written in I think the mid 2000s.
Mid
2000s by Jim Collins. Good to Great.
And it wasn't even about digital. It was just about how these companies, good companies, differ from great companies,
and how good companies became great. And one of them, they were early adopters of technology. So as a business, when you see a new technology, the companies, the people that have adopted that early on, and they're adopters of this and embrace this change, are the ones that just happen to be in the forefront, right? Today, the people that are now starting to dabble with digital marketing, again, they're way behind. You're right. And digital marketing is something for me, right? Everybody gives it its definition, right? Today, if somebody's dabbling in their restaurant with social media posts, they're doing digital marketing, right? That's their definition. To me, digital marketing meant at the time, 100% I have to acquire my clients online. If I don't, my business sucks and fails.
Right.
Especially with Obamacare, right?
Yeah.
With this whole law, right? So for me, digital marketing meant I had to acquire, number one, my lead online, and it had to be opted in, right? Somebody interested in, what I had to offer or potential, right? And so generating that, being able to process that, and then being able to acquire that customer also over the phone and online. That was, to me, digital marketing. And if I did that, I didn't have to invest in TV. I didn't have to invest in print or anything, right? And that's what I had to go do.
And you can actually track it, which is what's interesting to me. Being in the publishing business for 36 years, to be able to know what you're doing in digital marketing and track it and know where the money's working, where it's not working.
That's right.
What's bringing it back, where to double up,
That's
where
right.
to double down on, where not to double down. I mean,
That's
shit,
right.
We had this kind of stuff in Vegas. We can be rich right away if we had this kind of background
That's correct.
information and knowledge. So that's kind of cool. And you really don't have that in others. You could possibly find out through, but how many times do you walk into a place and buy something and they tell you, how'd you hear about us? I don't know. I don't know if it was a radio or a magazine ad or I saw it on TV, and somebody puts down whatever they want. So, but that's not real demographics. That's not real analytics.
No.
Real analytics is
or usable.
Or usable. That's real analytics is digital marketing and being able to track exactly who that person, where he clicked, where he went, what he liked, what he didn't like, what he did. That's the fascinating thing about digital marketing. Huh?
And that's how I growth hacked my industry. That's how I beat my market by 35% in health insurance.
Wow.
Then I went and I beat the market in the provider world, generating client acquisitions for my own. I had a substance abuse center, and it generate my own, clients and patients, and doing that process through my own 100% online platform, we beat the market by 50%. So talk about being profitable, talk about scaling a business quickly, talk about growth hacking any industry. When you hear what digital marketing can do, and it's not because it's some voodoo magical way of acquiring a customer. It's exactly what you said. It's empirical evidence that you have at your fingertips to be able to make an objective decision about a business investment that can result in making you money or not today, not tomorrow, right?
And that's relatively quickly. You don't have to wait a year after a year campaign to find out what worked, what didn't work.
Correct.
A week or two.
Days.
And you know what's working.
So for us, right, and again, everybody gives digital marketing their own meaning according to their view, their lens, right, in which they view the world. For me, my worldview was, I do this, I succeed, and I can profit, and I can, live another day in business, right? Yeah. I don't do this. I pack it up, go home, I go do construction, do something else, like throw away the 6 years, 7 years of building, right? That was what digital marketing meant to me, right? And so I just immersed for years, but the way that I was able to crack that code, and then and I'll give you the numbers. I remember I was a $360,000 firm every year. $420,000, which is respectable for an insurance firm, right? It's not, a big $1 million round table producer, which that's an elite level, but it's not a dog, 70,000 struggling every year. It was successful. Yeah. But really, what completely. Is that the Cuban coffee effect?
That's the Cuban coffee effect. Even the freaking computer's doing that. Oh, that's a Microsoft update. All right,
but in just for me, being able to say, hey, listen, I need to market online and do this it's what took my agency from a 360 to 420 in a 9-month period. Now, mind you, it took me 3 years. I started in 2010 to really reinvest profits at a high level right back into into digital marketing 100%. By 2013, I was able in 9 months to really kind of crack the code, if you will, and my agency grew to a $1.5 million revenue business.
Wow. And how long?
In 9 months.
Wow.
And so then finished the year out strong, right? And that was all because, again, I lifted the glass ceiling and I was able to generate 100% of my clients for insurance. And again, this is the same for any business. It could be real estate business. It could be if you're a car dealer. It doesn't matter what you sell, whether it's online or offline, right? Once you can generate for me, I had to generate my own oil, right? That is what gave me the autonomy, the actual real freedom to go out and do the technology and do the things that I needed and that I wanted to do. But, that's what it did. The second year after that, same technology, same digital marketing, just now I'm a little bit better at it, right? I popped $2 million of revenues, gross revenues, sales revenue right into the bottom, into the revenues. Wow. 30% margin, so 20% margin. I was still trying to figure out how to make more money, right? And then just kind of that was kind of what grew. I always paid myself a very humble salary, to when I say humble, I mean, I was able to pay myself very good, right? But I just put everything back into the business, and so did my partners, and so everybody was involved with. But that's the digital marketing platform. It enables you to do that. Google, man, I just spent all my money in Google to figure out Google. I didn't spend money on Facebook. I dabbled in it back then, but so from 2010 to 2013, it was 100%. I spent $1 million in Google, trying to figure out, and I figured out what not to do.
and just so people understand, every time you put a post up on Facebook or something like that, they say, hey, boost your post for $30 or something like that. Boost your post, and you go and you pay the $30 and you pick a couple of things. That's really not Facebook advertising. It is Facebook advertising, but that's the simplest way for anybody to do it. But the type of stuff that you do now with StressFreeHealthOptions.com that you're doing to really promote
Advertise.
the company and advertise it. This is completely different. This is behind the you're the puppet master behind Facebook.
And a team of people.
Yeah, putting all this together, and
it's like
Google
a trading floor
and everything, right? And you're
just as an investment platform. That's what I always say.
So it's not that simple.
No.
A lot of people don't understand that. They see, oh yeah, I advertise on Facebook. How?
Yeah.
They put their Facebook. They either pay $30 for a Facebook ad or something like that. That makes it simple. That's kind of like a push button thing. Or they post on Facebook and they have a million likes would be phenomenal, but they got 100 likes or something like that, and that's the way they advertise on Facebook. That's not digital advertising. That is to the simplest, most basic form, but the real way that you guys do it, I mean, to be able to go behind the scenes, put some serious money, like a couple $1,000 a day, on
a lot more
than that sometimes, and produce ads. Promote these ads
to generate,
and find people all over the country that are receiving these ads directly because they're the ones interested who need it,
and take action and get them to take action,
right? And click and call,
so you can sell and close
and go.
That's right.
And that's the kind of
that's it.
That's really the Facebook advertising that you're doing.
That's right.
Through digital
that's right.
company, Selecta Insider DM.
That's correct.
Yeah,
correct.
Which is who hosts, by the way, our podcast here as well. So it's all a nice, a lot of synergy involved with all these companies.
Absolutely,
which is fantastic.
Absolutely,
because these podcasts will be up on Selecta Insider DM's Facebook page, right? Yeah, our Facebook page. Huh?
And YouTube page.
And YouTube page.
And YouTube.
That's
right.
Yeah,
I said Facebook. Yeah, YouTube page. You're right. Yeah.
That's it. You're 100% right. That and look, it's real simple, right? To me, digital marketing, again, at the time, it meant number one, if I don't do this, that's the demise of my insure tech, because it's an insurance technology world that I lived in. Right, it was the end of that, and it was also, or it was. You make a lot of money, right? Yeah. And so I took the choice B. Let's play with that one. But it was basically, for every dollar that you invest, how do you get 3 or 4 or 5 back? Whether it's real estate, whether you sell on Amazon, you get a product for $1 and you're able to resell it and get $2 back. I mean, it's a sales 101, right? It's just business 101, right? It's just amplified, right, through digital marketing, where you can place much smarter advertising bets, right? Because somebody advertises and says, listen,
that's cool. The way to look at it. Advertising bets.
Advertising
bets. Because you've
always
always said I've heard you say it a couple of times in different interviews and stuff. It's a platform. It's a trading platform. Facebook is a trading platform. And when you advertise, it's a bet. And it's the same. It's just like if you were in the stock market. You're betting on this company one way, this way or that way, and you're buying this, you're buying that. So
and I'll tell
simple.
You, that helped me. My early days working, had my securities license, worked in the financial sector for a while, for a long time, and I was on the trading floor for a little bit, and getting to know really how a trade, how the stock market works, how does options trading work, and how does a float of money work, and the S&P and companies and all that. And so at the end of the day, that's really what it is. You hope to give Wall Street $1, or any investment, your bank or whatever investment, I hope that it gives you back a return, right? So it's not, it's the return, not just of your money, but the return on your money.
Yeah.
Right? Which is important. Yeah. And so when you're advertising, most people have it the traditional way where they put money out, right? And they have no way of knowing what's coming back or what's working or what's not, right? Then they kind of have an idea, and I like this. My customers say, this makes sense. But to have the true intelligence to be able to say, hey, listen, like the stock market, we advertised, right, in these trades in Google and Facebook and all these little platforms, and we advertised $1,000, and guess what? In clicks and traffic, sales, it converted into $3,000 for us, right? And that's a whole engineering piece to be able to put together to make a platform like this very successful. Make money, really. to be able to make money on.
No, and you're helping people out. You're helping people out at the same time.
You can't help people if you're not making the necessary money to do so, right?
Right.
And that's the concept with digital
business
marketing.
Has to be profitable. If not, it goes under, and it's not going to help anybody.
It can't help anybody, right? Yeah. So that for us, that was one of the other things with digital marketing, right? We knew where the market was, we knew where the challenges were, and we said, hey, look, if we could stay in this market, stay in front of this audience, digitally. We'll be able to help a lot more people be profitable and sustainable.
Yeah,
and that's really what it's done.
Peter, this has been super interesting, super cool, man. We got a lot more to talk about. You know, we can talk about this all day long, and there's always changes in the market and changes in insurance that are happening all the time. We see, Congress and everything.
Oh, it's very turbulent. So
it's turbulent. There's a lot of changes. So we hope to get you back here. Come back again and talk about updates and things and how things are changing and what's going on. But this has been super cool. I got something for you because I know you enjoy. And I know you're.
Man, that's great.
What's Cuban coffee without a nice cigar? This is the Arturo Fuente Opus X Super Belicoso. Be careful with it because it is a strong cigar, but it's the most delicious cigar you're ever going to try. Fuente is the best stuff you're ever going to have, you, no matter what. You're going to enjoy that. So thank you for being here. Thank you for coming, and we'll have you back here.
Thank you, Mike. Okay. Thank you, man. Appreciate it. Great being here, man. Thanks.
Yeah, great. Thank you for watching The Cuban Coffee Effect, where Cuban coffee serves as the catalyst for true and honest conversation among friends. If you enjoyed this podcast, give us a thumbs up and subscribe to our page. Stay up to date by following us on all our social media at Selecta Insider DM.